Hi, evening, everybody. How is everybody? I hope you had your dinner already. So, thank you for joining us today for today's health talk. Today's health talk is held in conjunction with Icon Cancer Center. I'm Andrew. I'm your host today. I'm the manager for psychosocial services. I'm also the counselor at 365 Cancer Prevention Society. Today's topic will be focusing on young women with breast cancer. As more and more women are diagnosed with breast cancer under the age of 40, today's talk will look into what is breast cancer, the unique challenges that this lady faces. Before I walk you through today's talk, please like and share the video, as well as 365 Cancer Prevention Society and Icon Cancer Center's Facebook and IG program on my left. So if you have any questions, comments, or encouragement, please feel free to comment as down below. We'll have a question and answer session towards the end of the health talk. So we will answer your to our best. So without further ado, we are very honored today to have invited two speakers today. The first speaker we have today is Miss Yvonne Ang. She's a breast cancer survivor. She'll share with us about her journey, the challenges that she faced. The second speaker will be Dr. Lee. She's a medical oncologist from Icon Cancer Center. She specializes in breast cancer, specifically focusing on young women and pregnancy-associated breast cancer. Dr. Lee is also the program director of Icon's Young Women's Cancer Program. Before we go on, let me just share with you what is 365 Cancer Prevention Society's services. 365 Cancer Prevention Society is a non-profit social service agency in Singapore, where cancer fighters, caregivers find support in their fight against cancer, learn how to prevent and manage with cancer. One of the major services that we have in 365 is care and support team, where the care leaders show care and concern through phone call or visitations. They also render financial support if the members are in need of financial assistance. Secondly, we have counselors, like myself. We help individuals to better understand their psychological needs and provide emotional support as well. Thirdly, we have dietitians, where we provide nutritional support and consultations. Last but not the least, we have social service centers, where they organize groups and social activities, such as detox exercise and Zumba. The location of the three social service centers are ABC. A, Ang Mo Kio, B, Bukit Panjang, C, Clementi, which is upcoming towards the end of this year. Also, if you would like to know more, you can always visit our website for the locations as well. Without further ado, let us invite and welcome Miss Yvonne. Hi, Yvonne.
Hi, Andrew.
I shall pass the time over to you.
Okay. Hi, good evening, everyone. My name is Yvonne. I'm 32 this year. I'm married for 7 years, and I have no children yet. Short intro about my cancer journey. I was diagnosed with breast cancer stage 2 last year in May. I had done my bilateral mastectomy, and I went through few rounds of chemotherapy. It's been a year since I ended all my treatments. I'm recovering pretty well now. As my breast cancer was caused by high in estrogen, so now I have to keep a close monitor with my estrogen level by doing frequent blood tests and scans. So I'm currently on medication, daily medication, and I had to go for this Leucrin injection every 10 weeks. And this will be on for 5 years. So the purpose of the medication and injection, I was told that is to stop my production of my ovaries and let me into early menopause. So my husband and I actually planned to conceive last year. But however, unfortunately, cancer struck me first, so that one put on hold. So back then, my doctor did suggested, to consult a gynae and discuss about options to freeze my eggs before I proceed with my surgery and chemotherapy, if I want to have children in future. So I went ahead and tried to contact a few gynae, but however, all the gynae I contacted had very busy schedule. So the earliest appointment I could get was like 1 month later. That was too long a wait. I can't wait because I was so anxious, and I just want to remove my cancerous lump and start my treatments as soon as possible. I didn't want cancer in me any longer. Therefore, I did not freeze up my eggs or talk to any gynae. So so now apart from staying healthy and hope that no cancer don't relapse, my other concern will be fertility. You see, because I still want a child. So as mentioned earlier, I'm currently in a menopause state, which means I have no ovulation for the next 5 years. So I'm actually quite worried that if there is any side effects with my current medication, and would that affect my will I be able to conceive after that? Because it's like a machine stop for 5 years. So am I able to function normally? So and of course lastly, if I'm lucky to have my own kid, and if it's a girl, my next concern is what are the chances that she might get breast cancer from me. So that's one thing that actually I'm not sure if this mindset is correct, but I'm just another part of me is thinking like if is it good that I won't have any kids? Like is it good if I choose not to have kids at the end of the day, so that I don't pass down this thing to them, I don't make them suffer. So yeah, that's what's my concern with fertility. Yeah, and summary of my cancer journey. So I think that's all from me. Thank you, Andrew, for letting me share my story and voice out my fertility concerns. And I hope to hear more from Dr. Lee later. And I'll pass back the time to Andrew. Thank you.
Thank you, Miss Yvonne.
Thank you.
Thank you for sharing with us your journey and experience, and as well as the challenges as well. So I hope the participants can also encourage, and let's put our hands together for Miss Yvonne, who is willing and very brave of her to share with us her experience as well. So before I move on to the next speaker, so hi everybody. So those who will just join us, and also please like and share the video again so more will benefit from the video. So next speaker we have Dr. Lee. May we invite Dr. Lee, please?
Hello.
Hi, Dr. Lee. I shall pass the time over to you.
Okay, sure. So thank you everyone for tuning in and spending the precious Saturday with us. And I really would like to thank Ms. Yvonne for her heartfelt sharing. And I really think, what you just shared is amazing. You're very brave there. So I hope the talk I'm going to talk about later will help to address some of these issues, which are really, really important for a young woman who is diagnosed with breast cancer. So let me just start sharing my screen first. Okay, so there we have it. So the topic I'm going to talk about today is on breast cancer with a focus on young women. And I'm going to take you all through, what the young women will face. It's not unlike what Ms. Yvonne had already shared. And I will talk a little bit about fertility preservation as well. So I think Andrew has already kindly introduced me. So just to add a point, I did a fellowship in a renowned cancer institute in US, that is Dana-Farber Cancer Institute. Why I mention this is because actually Dana-Farber was the first institute in US to come up with a young women with cancer program. So taking that back to Singapore, we have a young women program in ICON started by me, and it is really in alignment with my interest in young women with breast cancer, pregnancy-associated breast cancer, amongst others, gynae cancers as well. So briefly, this is the scope that I will be talking about. I will discuss the burden of cancer in Singapore, then more pertinent to lay people, maybe symptoms, risk factors to look out for, and also how do we treat breast cancer, the treatment modalities. And then subsequently, we will talk on breast cancer in young women, the challenges that they will face, and I will use a case study, a patient of mine, and also fertility preservation. So let's go into it. So I think it's very clear that, breast cancer is actually the topmost female cancer in Singapore. If we look at the graph, we can see that the pink line actually represents breast cancer. And the timeline is actually from 1970s to maybe 2015. And we can see within this time span, the incidence rate of breast cancer really tripled. However, I think the good news that we can focus on is the graph on the bottom. We see that the mortality rate for breast cancer is actually more or less stable. And this is probably in part due to breast screening, which helps us to pick up early cancer, which can then be cured. So when we talk about breast cancer, I think it's important to just go into the anatomy so that we know exactly where the breast cancer arises from. So if we look at the breast anatomy, much of it is made up of like fat tissue, muscles, and connective tissue. The part that makes up and contributes to the cancer is actually the lobules and the ducts. So the lobules of the breast is the area that really produces the milk. And then the ducts is the structure that conveys the milk from the lobules to the nipple so that the milk is produced and can feed the baby. So if we look at the statistics, the ductal carcinoma, which is the cancer that arises from the duct, the most common cancer, and they made up about 60-70% of the breast cancers. The rest of it mainly is lobular carcinoma, which can be up to 20-30%. And then there are more rare subtypes, which I will not go into in this talk. So what are the most common symptoms to look out for? I think the most common symptom is still a breast lump, or it can present as a lump in the armpit, or even changes in the shape or symmetry of the breast. They can also present as skin changes, or even nipple retraction, or nipple discharges, or frank bleeding, or even pain. But these symptoms can also be due to other benign breast-associated disease, and they may not always be cancer. So I think one thing that is important is that how would you discover all this if you don't do a breast self-examination, right? So the main message is always, to regularly do a breast self-examination so that if there are any changes, you can pick it up as soon as possible. And if there are any issues, you can seek medical advice. So next we come to risk factors. What are some of the risk factors associated with breast cancer? We like to dichotomize it into modifiable and non-modifiable risk factors. So the modifiable risk factors are those that we can do something about and we can change it. So basically it includes like sedentary lifestyle, obesity, alcohol consumption, smoking, or taking hormones in any form such as hormone replacement therapy or certain type of oral contraceptive pills. The non-modifiable risk factors are those that we really can't do anything about, and being female and aging is something we can't do about. We can't, solve it, and so that is part of the contributing factor. Some races are more predisposed, and also family history. If there's a strong family history of breast or ovarian cancer, then your risk might be increased. And also early start of menstruation and also late menopause, because essentially they expose the body to a higher amount of female estrogen. And other factors such as delay or no childbearing for the same reason. And for some patients, they had chest radiation at a young age for another issue when they are young, this can further contribute to an increased risk when they are older. So what can we really do, right? I think most importantly, healthy lifestyle is very important. So we should exercise, try not to drink or at least drink in moderation, quit smoking, and most importantly, try to keep a healthy weight. So how much activity do we need? So the WHO actually recommends a moderate intensity aerobic activity up to or at least 150 minutes a week. So if you divide it by 5 and if you exercise like 5 times a week, then you try to do it for 30 minutes each. And what else can we do? So we can do breast cancer screening. So in Singapore, our national cancer screening guidelines really advocate screening from 50 years of age, at least once every 2 years for mammography. And if you are 40 to 49, the suggestion is to discuss with your doctor. For younger women, maybe you need to start earlier, especially if you have a strong family history, and that is really by case by case consideration. So what is a mammogram and what is the tip for getting one? So a mammogram is really an X-ray picture of the breast. So your breast will be sandwiched between 2 plates for the X-ray to be taken. Sometimes a lot of women may tell me, they feel that it's very painful, it's very uncomfortable. But the process is generally very fast. So you just need to bear with the discomfort for a very short period of time. And there are some tips to make it maybe a little bit better. So you try not to do a mammogram before or during your period because your breast can be very tender and sensitive. And then during, when going for the mammogram, try not to wear perfume or deodorant because it can affect the X-ray picture. And for breast cancer diagnosis, what happens? So first of all, clinically, if you examine, if you feel a lump and then on mammogram we see something suspicious, the next step will be to confirm it with a biopsy. So what is really a biopsy? It basically we use a needle to take sample of the tissue from the lump, and then we look at it under the microscope to see whether it is indeed a cancer. It's a confirmatory procedure, and it is usually an outpatient procedure. So it is also quite a fast procedure. And when we go to breast cancer treatment, we really have to talk about breast cancer staging. So it is really very technical. So just to summarize it, the panel on top, stage 1 to stage 3, really means that the cancer is all localized. It is localized to the breast as well as the surrounding lymph node. And we are talking about the lymph node underneath the armpit. If the cancer has gone to stage 4, then it potentially has really spread to the brain, the lung, the liver, or even the bone. Even though it is not curable, it's still highly treatable. So when we talk about the treatment for breast cancer, we really want to talk about, what is the treatment, how do we treat it, when do we treat it? So the what, how, when. So when we talk about what, we want to know, whether it is early stage, whether it's late stage. When it's early stage, the treatment is really curative and you can be cured. So the main treatment really is a mixture of local therapy and systemic therapy. When we talk about local therapy, we are talking about, primary treatment with surgery where we remove the lump in itself, and then we follow this up with systemic therapy, and this can be in the form of hormone treatment or chemotherapy or even targeted therapy. So these are mainly to reduce the risk of recurrence later on. So for late stage treatment, even though it is not entirely curable, but we still aim for treatment for it is still very treatable, and we still aim for long-term control. And that is the reason why the treatment is focused mainly on systemic treatment. So the systemic treatment will also include like chemotherapy, hormone therapy, and targeted therapy. The local therapy is usually only for symptom control and to palliate the patient. And also when we treat breast cancer, we really want to know the biology of the disease. It's just like Miss Yvonne's case, when she mentioned about her disease is hormone sensitive, so we are talking about hormone receptor. So basically, when we talk about hormone receptor, we are talking about estrogen receptor, progesterone receptor, and the targeted treatment that targets HER2 receptor is also one of it. So it's not unlike a lock and key analogy, we are trying to find the right key for the right lock so that we can really treat the disease and control it. So basically for treatment, we have to know the stage, the grade, the biology in terms of hormone receptor status for breast cancer. So when do we treat? So that's a question. And for early stage cancer, the primary treatment is still surgery. So when do we give systemic treatment? We give systemic treatment in the form of chemotherapy, with or without targeted therapy, depending on the biology. And it can be given before surgery or after surgery. So if it's given before surgery, we term it neoadjuvant treatment. And if we give it after surgery, then we term it adjuvant treatment. The rationale of giving it before surgery is so that we can quickly target the cancer, rapidly shrink it down, so that for most women, they prefer to have breast conservation to, just remove the lump and conserve the breast, and that can be done. Both the neoadjuvant and adjuvant treatment aims to reduce the cancer recurrence. And how is it given? So usually, chemotherapy is given like in a cyclical fashion. It's given like either every 3 weeks or every 1 week. It allows the body to rest before the next dose is given. For systemic targeted therapy, it usually lasts a bit longer, maybe for a year, and it's also given in a cyclical way. For hormone therapy and radiotherapy, they are usually given after the chemotherapy. And the hormone therapy can be as long as 5 to 10 years. It's an everyday pill. It's not unlike, a treatment for chronic disease like hypertension where you have to take a medicine every day. And what are the common side effects? I think there are possible, many possible side effects, but I just want to highlight that different people, they actually respond very differently. So, if you have friends, telling you that they suffered very badly, and if that puts you off your treatment, my advice is, still, it really depends on your body and your constitution. So while someone may breeze through the treatment, you may also have, slightly more side effects than other people. So we don't know unless you try, you see. But nowadays, the good thing is that we have a lot of medicine to target all these side effects. For instance, like nausea, vomiting, we have like very good class of medicine nowadays. And most of the patients do not have significant nausea and vomiting during chemotherapy treatment. So next, let's come to our population of young women less than 40 years. So like what we have mentioned, in Asia population, this number is much higher. If we contrast it with the Western population, then we can see that this number is really high. So in Singapore, 44 years and below, that the breast cancer statistic makes up for about 18-19%, which is very high. So the general treatment principle really, they do not differ from that of the older women. But, a lot of consideration must be given to numerous psychosocial issues that young women face. And some of these are already illustrated by our guest just now, Ms. Yvonne. Very pertinent issue. So let's go into it. So when you're young, you may just be starting a family. You may be at the peak of your career, or you may, be fresh out of work, out of school even, and you may be even repaying loans. And then you have to juggle between work and your family. And you may have peer pressures because, your peers, they are probably at a different stage of life, And because of the medication, the side effects, sexuality, fertility, relationship can all be an issue. Body image and self-image can also be an issue. And all this will in turn affect, the compliance of the patient taking medicine as well as adherence to medicine. Last but not least, fertility as well as hereditary disease is also a consideration. So when we come to treatment, hormone treatment in young women may involve addition of ovarian suppression, like what was mentioned just now. Basically, ovarian suppression means, an injection every month or even every 3 months to induce the body to go into early menopause. And it's not difficult to imagine. For younger women, their hormone drive tend to be higher. So if the hormone drives are rapidly shut down, we can see that their side effects is usually more pronounced. So they can suffer from hot flushes, mood changes, depression, insomnia, weight gain, osteoporosis, etc., which potentially can be worse off in younger women compared to their older counterparts. So other issues such as finances, employment, and at the same time taking care of young family. So they really, really do need a lot of psychosocial support, family support, peer support, and support groups if possible. So when we talk about treatment in young women, I think a lot of people will question, is the treatment any different? Usually the treatment is not different per se, because it still depends on the stage of the cancer as well as the biology of the cancer. But because in younger women, the index of suspicion is usually lower. So not a lot of young women will think that, that alarm translate into cancer, because they may think that they are still young. So generally, when the cancer presents in a young woman, and by the time it's found out and present to a doctor per se, it's usually larger and it can be more aggressive, and it is usually diagnosed later. And because of this, the systemic treatment usually involves neoadjuvant treatment first, rather than adjuvant, because we want to rapidly shrink down the cancer. So I think maybe it's easier if I highlight a case study so that we can go through it together, rather than just going on about the theory, right? So this is a patient of mine still, and she was diagnosed when she was 30 years old, and at diagnosis, she just gotten married a month before. So it was quite a shocking event for her when she was diagnosed. So she had a 4-centimeter breast cancer. It is a hormone receptor positive and a HER2 positive breast cancer. Luckily for her, the lymph node was negative. So she was quickly worked up for chemotherapy. And at the start I sent her to see a gynae, because she just gotten married and she hasn't completed a family. And we also had genetic testing done. And very soon after, we managed to start her on neoadjuvant chemo plus targeted therapy about 2 to 3 weeks later. And I would say that this is no mean feat, because, from the point of diagnosis to starting chemotherapy, it is within a very short time of 2 to 3 weeks. And in fact, within these 2 to 3 weeks, we managed to do a lot of things. So we managed to get her to a gynae. She actually managed to go through a cycle of IVF per se, and managed to extract the oocyte, the egg, and she did embryo cryopreservation. So the good thing is that this is all very timely, and she managed to start the chemotherapy in a very good time. So I will come back to this case later on. So I really want to talk about fertility preservation. Why is this important? A lot of you may ask. And I think it's very important because, the good news is that now early stage breast cancer patients, they tend to survive longer and longer. Their 5-year survival can be as high as 90+%, which is good news. And so it's very important to ensure that the survivors have good quality of life, that they are able to pick up their lives from before diagnosis. After they finish their treatment, then they can go on to, look towards a fulfilling life of getting married and having kids. So basically, the message is that young survivors, they have years ahead of them. So what do we talk about when we, discuss fertility issues? I think it's very important to find out at which stage is the patient. Then we need to establish if their family planning is completed. They need to be thoroughly assessed by a gynecologist. And some of the common questions that they will ask includes, can I check my fertility level before treatment? How will my age affect my fertility? And what are my chances of getting pregnant after treatment? How can I try to preserve my fertility? These are all very valid questions. And it helps if we go into the background, like Fertility 101, just to understand a little bit about women's fertility. So women are born with a fixed number of eggs. This number will decline through life, the quality of eggs will also decrease with increasing age. By the time menopause sets in, around 50 years of age, the ovaries essentially stop releasing eggs. So when it comes to chemo treatment and breast cancer, the likelihood of subfertility will also depend on a few factors, such as the types of drugs used, the dose given, the current age of diagnosis, and what was the fertility level before treatment. So it's really important to consider the treatment before we even initiate chemotherapy for breast cancer. And usually the gold standard is by egg freezing, which is oocyte preservation, or embryo preservation. So I have an asterisk there that says Singapore law. So what it means is that in Singapore, the law dictates that for embryo preservation, the couple must be legally married. So other methods which are really there are also avenues for fertility preservation, but they may not be the gold standard. That includes ovarian tissue preservation as well as ovarian suppression. So I just want to highlight this trial. This is a scientific trial. It's called a positive trial. And basically, what they're trying to do is that they're trying to study whether pregnancy after a breast cancer diagnosis is actually safe. And this is an international collaboration. We have trial sites in US, we have trial sites in Europe as well as in Asia. The schema, just to mention for interest, is that breast cancer patients, they are enrolled, and then after they finish maybe 2 years of hormone therapy, then they take a break and go ahead to conceive and give birth, and then following that they come back and complete the hormone treatment. So this study actually aims to find out whether taking a break from the hormone therapy in between to have children actually affects the breast cancer outcome. This is a prospective study. While we have retrospective data, meaning if we look back at the breast cancer cases and we see those who gotten pregnant and those who didn't, the retrospective data actually suggests that getting pregnant after a breast cancer diagnosis is not detrimental. So to supplement that, this is a trial that look at the data prospectively. So this will be more convincing. And this result will be out in a few years' time. So coming to genetic counseling for hereditary cancer, I think all of you must have heard of the Angelina effect. So basically, Angelina Jolie had the BRCA1 mutation. So when a breast cancer is diagnosed in a young lady, so there's always, the thought of whether this could be hereditary in nature. So this is not an easy process for any patient because they need to go for genetic counseling. Then they need to make a decision to see whether they want to do the testing. And after the testing, they still have to go for a post-test counseling. And if they are indeed positive, then there will be a further discussion on whether they want to go ahead with risk reduction surgery. So this cartoon really illustrates that it's not an easy process. It usually requires multiple consults. So I think coming back to this case study, just want to tell you all what is the result for this patient. So at the time of surgery, her genetic testing actually came back and she was indeed positive for BRCA1 carrier. So just nice because the result came back before her surgery, and at surgery she decided to go for a double mastectomy and she had immediate reconstruction after that. She also successfully completed her adjuvant treatment as well as her hormone therapy for 5 years. So at 35 years old, she told me she wanted to get pregnant, and she underwent successful embryo implantation and she gave birth. So this is actually a happy story for her. And after she gave birth, we went ahead to discuss whether she wants to remove the ovaries as well as the fallopian tube to further reduce her risk of ovarian cancer. So I just want to highlight again that for young women with breast cancer, we do recognize that, they have a lot of psychosocial issues, including, complex issues such as fertility, fertility preservations, as well as hereditary cancer problems. So in ICON, we do have a young women cancer program, and this program is really modeled after the US program, and we really walk the patient through step by step from diagnosis, then to fertility preservation, to genetic counseling and support options. So we recognize the issues and we specially cater the program to work with the patient. So last but not least, I think I want to end this presentation on a note of hope. You see, these are all the women with breast cancer. Basically, I think that there are a lot of treatment available now, so do not give up hope. Our hope is that, we can really treat breast cancer like a chronic disease. So with that, I end my talk. Thank you. Maybe I will pass the mic back to Andrew.
Hi, Dr. Lee.
Hi.
Thank you for sharing with us this very informative health talk. So regarding what is breast cancer and what are psychosocial challenges or concerns that young women faces. Okay, next section we have come to question and answer. So if you have any questions regarding breast cancers or regarding family planning, fertility preservations, you can always ask in the comments below, Facebook comment below. And also shout out to Hi, who those who have just joined us in this health talk. So yeah, without further ado, perhaps we can ask the first questions. Hi, Dr. Lee, what is the proportion of young women with breast cancer in Singapore? And actually, how young is considered young?
Okay, so like if I just tell you the number, it's very difficult to appreciate it. I think maybe we can contrast it with the Western population. Like in the Western population, breast cancer below 40 years of age is about 4 to 7% of the population. But in Singapore, if we look at the young women with breast cancer, younger than 44 years old, actually the proportion is about 18-19%. And this number in Asia, not only in Singapore, the number in Asia for young women with breast cancer is actually much higher than in the Western population. And how young do we say is young, right? So this is also a valid question because in different countries, actually, the cutoff it can be different. So in some country they say 45, in some country they say 50, in some 40. So in Singapore, we use 40. And why is that so? Because this is the age cutoff that we do recommend, that the patient should, we should discuss genetic counseling and genetic testing with the patient.
Okay. Thank you, Dr. Lee, for the answer. So next question, actually, we do have quite a fair bit of questions on food, actually. Next question that we have from a Facebook participant is by Singro Tan. So he asked, hi, Dr. Lee. His question is about what food can be avoided. Do you mean like to prevent cancer or something like that? I think his question is asking about what food to avoid. We're not too sure about the questions that you asked. Is it during treatment or is it to prevent cancer?
Okay, so I think this, like what food to eat, what food not to eat, is actually a commonly asked question. So I think if we go back to general like cancer prevention and just for healthy lifestyle, then WHO actually has some recommendation. So they recommend keep a healthy weight, keep a healthy BMI, try to do exercise, and try to avoid being overweight. And some food to avoid includes like processed meat. So the processed meats are something that which they actually highlight for us to avoid, because the processed meat can be high in nitrates and nitrites, and this can be carcinogenic. So otherwise, other things to avoid, other things to includes go for cancer surveillance, screening per se. Screening is important. So in Singapore, we have some screening programs, not only for breast, but we have for cervical cancer screening. We also have for colon cancer screening. So these are important things to take note of. So these are the general advice.
Okay, so we hope that we managed to answer your questions because I saw the comment, yeah, it's a prevention. So I think Dr. Lee managed to answer your questions about the food to prevent cancer. Next, hi Dr. Lee, I understand that actually Icon Cancer Center, right, has an Icon Young Women Cancer Program, I think, which is just shared with us, which is very comprehensive. So let's say many times, let's say if I'm a young breast cancer patient, a lot of time the focus, the doctors or the oncologists usually focus is on about scans result, what kind of treatment, chemo or radio. So how can I raise this issue of fertility preservations or family planning to my oncologist? Maybe because we're Asian, it is a bit that maybe a bit shy kind of topic. How, in your opinion, how can we share? Like I want to talk to my oncologist about this, but I'm not sure what kind of questions should I ask or how should I approach my oncologist.
Actually, if you are young and you have yet to complete your family, it should be a topic of discussion between you and your doctor. And so, I mean, either person will be, should talk about it and don't feel shy about raising the issue because, even if you are married and you have 2 or 3 kids, some people will still have some people will still want to have more kids, so it's really dependent on individual, and it is a valid point for discussion, so please do not feel shy to bring it up. In our young women cancer program, actually, we actually routinely find out about your family planning, about your social status,
Wow.
whether you have completed family, whether you have not. And then if you have not and you wanted help, actually we have tie-ins with gynecologists where we get, rapid the same day or the next day referral. You get to see a gynecologist the same day or the next day. And we generally could actually activate all the tests to start you on, the IVF or embryo cryopreservation. And I say that because, I have a few patients which I put on the program, and they are able to do their oocyte embryo cryopreservation within 2 or 3 weeks. And I could start them rapidly on treatment subsequently. Because we have an established program, so all these connections are already established. So this can be done fairly fast.
Okay. Thank you, Dr. Lee.
Hmm.
I think next question we have is, can physical activity reduces the risk of breast cancer?
Yes. So you see, throughout my talk and even, WHO, they really recommend exercise and keeping, body mass index to a healthy range. Why is that so? Because, actually for female, our fat cells, unfortunately, they produces hormones. So, a lot of studies have shown for patients who are obese, their risk of recurrence can be even higher. So my advice would be to stay healthy, to exercise, and try to stay trim.
So a healthy lifestyle is always a plus point. Okay, let's move on to next question. Okay. Okay, about this question. Hi, Dr. Lee. Is it advisable to remove fibroid breast lump rather than wait and to take risks of waiting for it to become malignant?
So for any benign breast lump, usually it really depends on what type of benign breast lump they are. There are many different types of benign breast lump. They could range from, cyst or fibroadenoma, or even something a little bit more sinister like radial scar. So I think it's first important when there's any lump that is new, it's important to get medical advice so that a doctor can find out a little bit more. You may then have to do a mammogram. And if once you undergo mammogram or ultrasound, then we have additional information, you see. On mammogram, we can see basically the radiologists have a method for determining, whether the lump is suspicious or whether the lump is truly benign. So all these are added information. If it is, borderline and it is a bit tricky, they may advise you to go for biopsy, and then we will understand, the lump a little bit better. So if there's anything that can potentially turn cancerous, then the advice will then be individual based, because it depends on the size, the location, and what exactly is the mammographic features. So then you will either go for regular follow-up, like 3 monthly or 6 monthly follow-up, or then the doctor may advise you to remove it in entity. So I think it's important to find out exactly what it is and then seek out your doctor's opinion for it.
Okay, so like what Dr. Lee says, to follow up closely with your oncologist and seek their opinion, and not to really Google and see from the Google how does Google helps you to translate.
The oncologist doesn't mean Dr. Google.
Yeah. Okay, next question. Okay. So we have from Miss T. So she asked about a question. Is itchy nipple a sign of sickness? And whether is it a sign of concern?
So I think it really depends on like how frequently you get it and whether it's persistent or not. So like some of the risk factors that I mentioned, if there are skin changes like flaky skin changes, and if it's there and it doesn't go away, then I think it's important to get medical attention. So first of all, I mean, there are many possibilities. It can just be eczema, it can be a skin issue, but it can also be something more sinister like Paget's disease or even, cancerous. So I think if there's something that is new and it doesn't go away, I think it's best to seek medical advice as well.
Okay, I hope that answer your question. Next question. What is BRCA gene? How does it affect men? Okay, this question I probably also quite concerned.
So basically, BRCA genes is a short form for breast cancer related genes, and there are like BRCA1 genes and BRCA2 genes. So what it does, right, is that it actually, helps in the repair of our genetic material to make sure that the genetic material is repaired correctly. So once the BRCA gene is mutated, then the genetic material may not be repaired well. Hence, that there can be mistakes along the way during the cell's replication when the cells, divide and replicate itself. So this will then give rise to cancer formation. So basically, BRCA gene can be inherited by both female and male. So it can be, so basically it's a gene and it can be inherited by both sexes. But the issue is that in male, because the risk of the breast cancer, the risk of breast cancer will be lower compared to female. There are other risks there are other cancers that BRCA gene predisposes to in male, and that includes like pancreatic cancer or even prostate cancer. So if you have a family member who is diagnosed with BRCA gene positive and you have a family history, then it may be advisable for you to get a medical advice also and to discuss with the oncologist when it's appropriate time for you to do screening, etc.
Okay, thank you, Dr. Lee, for that very informative answer. Next questions, let's see. Oh, okay. It's a pretty common food-related questions to breast cancer as well. Is soya bean safe for cancer patients with positive estrogen to either eat or drink?
Okay, so this is a very common question. So I think it's important to address this because a lot of people try to avoid soya bean or even soy drink. But there are research that says taking of this soy product is actually fairly safe for breast cancer patients because the estrogen is phytoestrogen is a plant-based estrogen, and studies seems to say that it is not actually harmful, but in fact, some studies actually contradicts and says that it can be in fact helpful. So the conclusion is that the soy for breast cancer patients, they don't have to avoid soy at all.
Okay. I hope that answer your question. Yeah. One more questions. How does treatment affect fertility? Cancer treatment is per se.
Yeah, very good question. So basically, cancer treatment can affect fertility because we use drugs such as chemotherapy, and chemotherapy basically, to put it simply, it is like a toxic thing, right? It's a toxin. Basically, it goes to your body. Why do cancer patients lose hair, and why do they get, things like diarrhea and all that? Because it targets the rapidly dividing cells, and cancer is one of them. But our hair follicles, our intestine lining, they're all rapidly dividing cells. So we lose our hair because of that. So the reason why cancer affects fertility is also because it affects other parts of the body as well. It can affect the ovary, hence it can can damage the ovaries and cause subfertility. So this is the reason why for cancer treatment, before we start cancer treatment, we want to introduce fertility preservation for women who might want to have kids later on in life.
I see. So that leads to the another question means it is best always to advise those who have not come on board on cancer treatment to talk to oncologists about fertility issues per se lah. Okay. So one last question maybe we can have for tonight is I don't know whether you answered the questions just now. In your opinion, what can be the preventive measures to take for breast cancer?
Preventive measures.
Preventive measures.
Okay. So I think we go back to our modifiable risk factors, meaning things that we can really do to prevent breast cancers. So again, I sound like a trainer. Again, exercise, try to keep a healthy body weight, and then try not to drink alcohol, because alcohol actually, increases the estrogen in the body. And also to try not to go for hormone replacement therapy if possible, because I know that for some women, when they go through menopause, they may have, very bad menopausal symptoms. So if possible, we can maybe consider, going through menopause in a natural way, find lifestyle modification to handle the side effects, rather than, going for hormone replacement therapy, which can potentially increase the risk of breast cancer.
Okay, thank you, Dr. Lee. So I think she has also repeated at least twice. Now she says she sounds like a trainer. So these are the preventive measures to prevent, breast cancer. So let us put our hands together again to thank Dr. Lee and Miss Yvonne for sharing with us her journey and very informative about breast cancer. Thank you, Dr. Lee. So there are many cancers that are increasingly affecting women under age of 40 in Singapore as well, especially breast cancer. So in today's talk, we have learned about breast cancer and the types of treatment, the psychosocial concerns, and fertility preservation. We also get to experience or learn about the challenges from family concerns to body image to societal expectations. It is definitely not an easy journey. So don't face all the challenges alone. We are all here to help you as well. Before I end today's talk, please remember to like and share the video, and also to like the Facebook and Instagram of 365 Cancer Prevention Society and Icon Cancer Center as well. So let me just share with you the next health talk we have in October. The next health talk we have in October is emotional changes in cancer patients. The speaker will be Dr. Daniel Quek. He's a senior consultant in psychiatry. So it will be held in 17th of October, 8 p.m. It will be conducted in Mandarin. Yeah, so I hope to see you guys on 17th of October again. Thank you.